Hello again. In this presentation, I'll try to explain the blood pressure, which is one of the important topics in the cardiovascular system. It has many clinical implications. So let us get started. As you know, the blood pressure is defined as the force of the blood that is exerted against the inner walls of the blood vessels. So we need a force to push the blood to move and to circulate in the blood circulation. And the blood pressure is usually refers to the pressure in the systemic arteries. So, because usually the veins and the capillaries they have very less pressure, and the venules and the veins sometimes they don't have any pressure. Okay, so mainly the pressure is found in the arteries and it exists throughout the vascular system, but as I said, in the veins it is very minimal pressure. That's why we use to measure the blood pressure in the arteries, mainly in the arm. So this pressure allow the blood to move through the blood circulation, especially the arteries, away from the heart. I think you are very familiar with this term. Systolic blood pressure is 120 over the diastolic blood pressure, which is 80. All of us know this term. But to understand it better, let us define some terms related to blood pressure. So, arterial blood pressure rises when the ventricle contract because this pressure comes from the ventricles. The arterial blood pressure in general comes from the pressure of the ventricles. Okay, so whenever the ventricular pressure rises, the arterial pressure rises, and whenever it falls, also it will fall in the arteries. Okay, so what do we mean by systolic pressure? Systolic arterial pressure. Systolic arterial pressure. This is the maximum pressure reached during ventricular systole or contraction. Okay, and the diastolic pressure, this is the maximum pressure remaining before next ventricular contraction. So in reality, we measure the pressure that is conducted from the ventricles of the heart. Okay, we measure it in the arteries because it is going to be transmitted into the arteries. Okay, we have other also very important clinical terms that are used in the clinical practice like pulse pressure. So what is pulse pressure? Pulse pressure is the difference between the systolic and diastolic pressure. The systolic and diastolic pressure. So in normal individual, the pulse pressure equals 40 because it is like the subtraction of 120 minus 80, it equals 40. So this is the normal pulse pressure. And we also have a term of mean arterial pressure. This is a pressure, the average pressure, which is found in the systemic circulation. Okay, and it equals the diastolic blood pressure plus 1/3 of pulse pressure. Uh, so as we said, the fraction of the blood pressure is usually stated as systolic over diastolic. Okay, that is usually 120 over 80 millimeters mercury because the blood pressure is measured uh, by millimeters mercury, and we use the sphygmomanometer to help us measure the blood pressure. Okay, or we call it blood pressure cuff. So in this picture, you can see the sphygmomanometer. This is a sphygmomanometer and its different parts, and this is a cystoscope. Okay, so this is a sphygmomanometer. Uh, the idea behind the sphygmomanometer is to stop the blood flow in the brachial arteries by pushing air inside this cuff, which is going to work like ligation of the brachial artery. And after that, the pressure that push the blood to go through the brachial artery uh, will be measured and auscultated by the cystoscope. So the first beat that we can hear when the blood flow uh, and overcome the pressure that we created by the cuff and the air that stop the blood. This is equals the systolic blood pressure, and this pressure we will feel it like very loud uh, beats that we hear them in the cystoscope. And when the sound drops, that means now there is no any resistance, and this is the diastolic blood pressure. Okay, so in normal individual it is 120 over 80. So the pressure varies according to the blood vessels. As I said, it is higher in the arteries and arterioles, and whenever we go far from the heart, the pressure will drop. And as I said, in the veins and venules, there is no pressure, very minimal pressure. Okay, so the highest pressure is found in the aorta. It is very similar to the pressure in the ventricles, which is 120 over 80, and still higher in the large arteries, and it started to drop in the arterioles and capillaries. Okay, there are certain arteries that are accessible and probably under the skin, and we can easily palpate them to feel the pulse. Okay, so we can use the radial artery in the upper limb, the brachial artery. This is the artery which we use also to measure the blood pressure. Okay, so radial artery, brachial artery. In the lower limbs, we have the femoral artery, popliteal artery, dorsalis pedis artery, and posterior tibial artery. In the neck, we have the carotid artery, the facial in the head, and the temporal as well in the head. So we can use any of these arteries to measure the arterial pulse. Okay, and you need to train yourself to do both the proper as well the pulse assessment. Okay, let us study the factors that influence the arterial blood pressure. And in general, the blood pressure is affected by two major categories or factors. We call them cardiac output and peripheral resistance. So these four factors in reality affect the cardiac output. So we'll talk in minutes about the cardiac output, but the blood volume. If the blood volume increase, this will lead to increase in the blood pressure. The heart rate. If the heart rate and heartbeat increases, then this will lead to increase in the blood pressure. The stroke volume, which is the blood ejected per beat from the ventricles into the systemic circulation, if it increases the amount of blood, this will also increase uh, the blood pressure. And also the blood viscosity. If it increases or it decreases, it will affect the blood pressure. Okay, so all these four factors affect what is called cardiac output. And on the other side, we have the peripheral resistance. Peripheral resistance mainly depend on the arterial uh, lumen. If the lumen of the arteries dilate, this will lead to a reduction in the blood pressure. And if the lumen constrict, this will lead to increase in the resistance and as well increase in the blood pressure. Okay, and as you know that the blood vessels are affected by mainly by sympathetic. So sympathetic flow can lead to vasoconstriction and like parasympathetic or insufficient or when we block the sympathetic, this will lead to arterial dilatation, and this will lead to reduction in the blood pressure. So these factors related to the heart and the amount of blood ejected from the heart and this factor related to the blood vessels. So if you affect any of these elements or factors, this will lead to a change in the blood pressure. Okay, so we came to the cardiac output, and as I said, cardiac output. Before we understand the cardiac output, we need to know what is the stroke volume. Stroke volume, this is the amount of blood ejected by each ventricle, okay, per beat, per each beat, and it equals like 70 milli per beat, okay, 70 milli of blood is ejected uh, in each cardiac beat. The cardiac output, this is the volume of blood that is ejected by ventricles in 1 minute, okay, in 1 minute. So the cardiac output uh, equals the stroke volume, which is the amount of blood ejected per beat, uh, times the heart rate. And usually the heart rate, the average is 72. So if you calculate it 70 milli, which is the stroke volume, the amount of blood ejected by each ventricle per beat, times the number of beats, which is average 72. It can be more than that, can be less than that. This will give us like an average of 5 liters of blood ejected per minute. So each minute, the heart eject like 5 liters into the blood circulation. Okay, so this amount of 5 liters, the average is called cardiac output. Okay, so the cardiac output is very important in the issue of understanding the concept of blood pressure and regulation as well of blood pressure. So any increase in the stroke volume, which is the amount of blood ejected per beat, or the heart rate, increase in the heart rate or decrease in the heart rate, for sure this will affect the cardiac output. Will be more than 5 liters or less than 5 meters, and for sure this will also affect the blood pressure. So as I said, cardiac output equals stroke volume times the heart rate. So let us discuss the factors that we mentioned earlier in the previous slide. We said that the blood volume, the stroke volume, okay, and the cardiac output, the viscosity, all these factors affect the cardiac output. Okay, so let us shed some light uh, over each of these factors just to understand it better and to understand how are we going to control the blood pressure. So the blood volume is a sum of plasma and four elements. This is the blood volume. Okay, and as we mentioned earlier, when we talk about the blood in chapter 14, we mentioned that the blood volume varies according to the age, children and adults, male and female. There's differences, but we said that it represents like 8% of the body weight, and uh, it is the average is like 5 liters. It can be more than that, can be less than that. Okay, so the blood pressure, because the blood volume will affect the stroke volume. Okay, and uh, for sure it will affect the cardiac output, so it will affect the blood pressure. Okay, so if the blood volume increases or decreases, this will affect the blood pressure. Okay, so for example, in case of hemorrhage, if you have hemorrhage, that means you have lost blood, so the amount of blood will reduce, so the stroke volume is going to be reduced, and the cardiac output and the blood pressure in general will be affected and reduced. So you have like hypotension or low blood pressure. So this is how the blood volume affects the blood pressure. The issue of peripheral resistance. I also shed some light about it. The peripheral resistance is a force of friction between the blood and the walls of the blood vessels. Okay, so for the blood to go through and to pass through the blood vessels, it needs these arteries to accommodate this blood and to dilate just to allow the blood to flow. If there is uh, friction or restriction in the way, then this will increase the blood pressure for sure. So blood pressure is required to overcome the peripheral resistance. And there are many factors that can affect the peripheral resistance, but mostly the issue of vasoconstriction. And as you know that vasoconstriction is mainly due to sympathetic stimulation. Sympathetic stimulation. Okay. The viscosity, this is also one of the factors that affect the blood pressure. We said that the blood volume, uh, peripheral resistance, the viscosity. So the viscosity, the greater the viscosity, the greater the resistance. And the viscosity can be defined also as the difficulty with which the molecules of fluid flow past each other. So the higher the viscosity, the higher the blood pressure. Okay, and the lower the viscosity, the lower the blood pressure, or less resistance and lower blood pressure. And this can be uh, seen in case of anemia. So in case of anemia, we have less number of blood cells or elements, or lower number of blood elements. This will lower the concentration of blood cells. Okay, so this will affect the viscosity. It will lower the viscosity, and for sure it will lower the blood pressure. So again, we can say if we wanna control the blood pressure, we need to control the cardiac output and to control the peripheral resistance. And any factor affect the cardiac output will significantly affect the blood pressure. And any factor affect the peripheral resistance will again affect the blood pressure. So let us correlate the concept again of cardiac output with blood pressure. Cardiac output, we said that this is the amount of blood ejected per ventricles in each minute. Okay, so we said that it equals the product of heart rate, which is 72 average, and the stroke volume, which is 70 uh, milli per beat. Okay, so the stroke volume itself is affected by the end uh, diastolic volume and end systolic volume. So what is end diastolic volume? End diastolic, this is the volume of blood in each ventricle at the end of ventricular diastole. So after the ventricles become full, then this amount of blood will for sure affect the stroke volume. And the end systolic volume, this is the volume of blood remaining in each ventricle at the end of ventricular systole. After the systole or after the contraction occur, we still have some blood remaining in the ventricle. So if we substitute the amount of blood at the end of the ventricular diastole minus the amount of blood at the end of ventricular systole, this is the amount that is going to be ejected, and this is actually equals the stroke volume. This is the amount of blood that equals the stroke volume. And this also can be affected by many factors like mechanical, neural, and chemical factors that will lead to increase or decrease the amount of stroke volume. But there is like we call this the issue of venous return, or let me say atrial filling. In general, we call it preload. We call it preload because now the ventricles are loaded, are full of blood. Okay, so the more blood that we have in the myocardium in general before ventricular systole, the more stroke volume we will have. Okay, and there is a very famous law which is called Frank-Starling law. This Frank-Starling law depends on the idea that the higher of end diastolic volume, the greater the mechanical stretch of the ventricular myocardial cells, which is a preload. So whenever the ventricles are full of blood, this will lead to a strong ventricular contraction. Okay, so if the filling of the myocardium is less, then we expect the beat to be weak. And as you know that the strength of the beat and the number of the beat together with the filling or the amount of blood, all these factors will affect the cardiac output, and the cardiac output is the main determinant of the blood pressure. Okay, so the preload and the afterload. Afterload, this is a force that the ventricles must provide to open the semilunar valves to eject the blood. So whenever we have uh, high pressure, then we expect, uh, I mean, in the semilunar valves and the systemic we expect this will affect the contractility of the heart. Okay, and the contractility of the heart itself. If the heart muscle is strong enough, this will lead to ejection and proper ejection of the blood. But if the heart muscle is affected by disease like heart failure or whatever, then we expect the amount of blood ejected and the strength of the heart contractility will be insufficient. Okay, so again, these factors affect the cardiac output, which is preload, afterload, and cardiac contractility. Preload, mainly the blood that return to the myocardium or the heart. The afterload is the resistance in the systemic circulation, especially the aorta and pulmonary trunk, and the cardiac contractility. This is the strength of the muscles. Okay, and we need to remember the Starling's law, the Frank-Starling's law for uh, of the heart, which reflect the strength of the myocardium contraction based on the amount of blood return into uh, the ventricles. Okay, and we also in the previous presentation we talk about the receptors of uh, blood pressure. So that we have baroreceptors which are found in the uh, arch of aorta and the carotid sinus. Okay, these receptors detect any change. They are very sensitive and they are very close to the heart. They detect any change in the blood pressure. So if the blood pressure increase, for sure the amount of blood coming through these vessels will increase, will lead to stretch of these receptors, and uh, they will send messages to the cardiac center in the medulla oblongata, and it will reduce the the heart contractility, okay, through parasympathetic system. Or if there is any drop in the blood pressure, again these receptors will not be touched by the blood or will be touched weakly by the volume and the amount of blood crossing these vessels, and again they will send messages to the cardiac center, which is gonna to control the heart again by sympathetic stimuli to increase the contractility of the heart, and as well to increase the peripheral resistance in the arterioles, and so on and so forth. So the chemoreceptors are very important in controlling and regulating the blood pressure. Okay, so epinephrine is a hormone that is secreted from adrenal medulla, and as you know that it is a neurotransmitter that stimulate or a transmitter for sympathetic system. Okay, so it increases the heart rate and it increases the peripheral resistance through vasoconstriction in the arteries. Okay, so it is like a mediator, and we also mentioned that the peripheral resistance is affected by the vasoconstriction and vasodilatation. Okay, so vasoconstriction occurs due to sympathetic stimulation, and vasodilatation increases arterial diameter, so it decreases the peripheral resistance and as well it decreases the blood pressure. And we said that we have the center, which is found in the medulla oblongata, and it regulates the diameter of arterioles. Okay, so if you look to this picture, maybe it is not clear, but you can look at it in your book. Whenever we have elevated blood pressure, this is going to be detected by the baroreceptors in the aortic arch and the carotid sinus. They will send messages to the cardiac center in the medulla oblongata and as well into the hypothalamus. And these are going to send messages just to control and regulate the high blood pressure. So the cardiac center is going to stimulate the parasympathetic system. It's going to inhibit the SA node and AV node and decrease the heart rate. Okay, decrease the heart rate. So by decreasing the heart rate, this will affect the cardiac output because the cardiac output is a summation of the heart contractility and as well the stroke volume. Okay, and as well this will the especially the hypothalamus, it will affect, and the cardiac center as well, it will affect the peripheral resistance by decreasing the sympathetic stimulation. So this will lead to arterial dilatation. So whenever we have arterial dilatation, that means we have accumulated blood into the venous system. So the venous return to the heart will decrease, and this will for sure decrease the stroke volume. So now we decrease the cardiac output because we decrease the stroke volume and we decrease the contractility of the heart. So these two measures for sure they will affect the cardiac output and they will affect the blood pressure and pull it back to the normal, which is 120 over 80. The opposite is correct in case of low blood pressure. If we have hemorrhage uh, or there is any problem in the heart or whatever, this will lead to low blood pressure. So low blood pressure again will be detected by the baroreceptors and carotid sinus. They will send messages again to the cardiac center and hypothalamus, and both they will stimulate in this case they will stimulate sympathetic system. Sympathetic system will increase the outflow to the SA node and AV node and will increase the heart rate. Okay, so they will increase the cardiac output, and as well they will stimulate the blood vessels, especially the arteries. So they will lead to vasoconstriction. This will lead to increase in peripheral resistance. So more blood will go back to the heart, and as well the resistance itself will increase the blood pressure. And we said that in case of drop in the blood pressure, the venous system, the veins will also be stimulated by sympathetic, so they will increase the venous return to the heart, so that will increase the stroke volume and the cardiac output. Okay, so these measures will increase the blood pressure and pull it back to the normal. Okay, so this diagram is a summary of what we just said. This is the issue of the heart and this is the issue of the blood vessels. So cardiac output increases. This is in case of high blood pressure. Blood pressure increases. Receptors detect this change, sensory impulses to the cardiac center, then the parasympathetic impulse to the heart will affect the SA node and AV node, so they will be inhibited. This will reduce the heart rate, and by so doing, as a consequence of that, the blood pressure will return to towards normal. And rising blood pressure again will stimulate the baroreceptors and chemoreceptors, sorry, baroreceptors in aortic arch and carotid sinus. This will stimulate the cardiac center or vasomotor center. Okay, this will lead to vasomotor center inhibited, less frequent sympathetic impulse to arterial walls, vasodilatation of arterioles, decrease peripheral resistance, and blood pressure return to normal. So one of the very important applications of blood pressure is hypertension. Hypertension is a very common disease and it has very horrible and serious consequences. It is defined as long-lasting elevated arterial blood pressure, mostly more than 90%. It has no clear cause. It has no known cause, unknown cause. Okay, but in very few cases it can be secondary to increase in sodium intake because sodium intake will increase osmotic pressure, will increase the blood volume, psychological stress. This will increase the cardiac output because it will increase the heart rate and so on and so forth. The sympathetic innervation, obesity will increase the peripheral resistance and the kidneys. This will affect the renin-angiotensin system. We talk about it in A and B1. And hypertension is considered as a silent killer because in most of the cases it has no direct symptoms. And unfortunately, hypertension will lead to formation of atherosclerosis, so it will affect the blood vessels, leading to thrombosis and embolism, leading to transient ischemic attack or uh, cerebral thrombosis or embolism. And this will affect the heart and as well the brain. Both diseases are very fatal ones. Okay, so how to prevent the issue of blood pressure? You have to sustain a healthy diet and weight. Just reduction of weight can be one of the excellent intervention for reducing the blood pressure, and as well doing regular exercise and limiting sodium intake, mainly the dietary salt found in the dietary salt. Okay, so uh, we have the concept. We talk about arterial components of the blood pressure, but also we have the venous blood flow. The venous blood flow, this is the pressure. The blood pressure decreases as the blood moves through the arteries, okay, or arterial system and into the capillaries network. So very little pressure remain at the venous end of the capillaries. But the venous blood flow is also important, okay, because uh, it partly result in heart action. So how do we increase the blood flow? The blood flow is affected, the venous blood flow, I mean, is affected by skeletal muscle contraction because there is no pump. So the muscles pump the blood, especially from the lower limb towards the heart. And also the respiratory movement. So whenever you take like a deep breath, this will reduce the pressure inside the thoracic cavity and the pressure in the abdominal cavity will be higher than the thoracic one. So this will push the blood from the abdomen, which is coming from the lower limbs, pelvis, towards the heart. Okay. And also the issue of venoconstriction. So under conditions of low blood pressure, the sympathetic reflex cause contraction. We talk about this many times. The sympathetic mainly affect the arteries, but it can affect the veins, leading to smooth muscle contraction. So this will increase the venous blood flow. Okay, but in general, the veins, uh, if you remember, we said that they accommodate most of the blood, like two-thirds of the blood in the body is found in the veins. So they act like a blood reservoir. Okay, but if uh, as you see here, this is the veins, especially in the lower limb, they have valves. When the muscles contract, they act like peripheral heart. So they push the blood up towards the heart because it moves against the gravity. So we have the concept of central venous pressure, which is the pressure in the right atrium. Okay, and the pressure in the right atrium is affected by the amount of venous return to the right atrium. Okay, so if we have weak heart due to any problem in the heart, like heart failure, then we expect the heart will not pump properly, and the cardiac output will be affected. So the blood will continue accumulating in the right atrium because it is not well ejected into uh, the arteries, the aorta and the pulmonary trunk. So the blood will accumulate in the ventricles, in the arteries, leading to increase in the central venous pressure. And if there is increase in central venous pressure, for sure this will like will affect the venous return from the lower limbs, from the other parts of the body, and accumulation of the blood in the peripheral veins. This will lead to formation of edema. Okay, so this can lead to peripheral edema. Peripheral edema is associated with heart failure or increased central venous pressure. Exercise, and we used to talk many times about exercise and its importance in uh, the health in general and cardiovascular system. Exercise is very important for the heart. It increases the efficiency of the pumping of the heart muscle and as well the hemoglobin concentration. Generally speaking, athletics they have larger heart, like 40% of the individual who do not practice exercise. So everything will be better if you do exercise. And the most important thing is that regular exercise will decrease the blood pressure. So if you have hypertension and you started doing exercise, the hypertension can subside just because of your lifestyle and practicing exercise. To have a beneficial exercise to the heart and the cardiovascular system, you need to the exercise must increase your heart rate by 70 to 85%. So you have to have like strong exercise that lead to increase the heart beats, and as well the exercise should continue at least 30 minutes to 1 hour. This is excellent type of exercise, and at least 3 to 4 times a week. We talk about the pulmonary circuit and the systemic circuit before. So the pulmonary circuit in general between the right side of the heart and the lungs, and the purpose for that circuit is oxygenation of blood, and the systemic circuit between the left side of the heart and the systemic circulation, the arteries and veins and capillaries, and mainly this is due to, or the purpose of this systemic circulation is to exchange the substances between the blood and the tissues. So the blood will be loaded by oxygen and the carbon dioxide will be taken back from the tissues to the heart. This picture or diagram showing the alveolar wall and the osmotic pressure. Uh, as we said that the capillaries everywhere at the level of tissues, they exchange substances between the capillaries and the tissues. So here this is the alveoli, and the alveoli contain more air. We don't need fluids here. So the idea is that the hydrostatic pressure lead to slight net outflow of fluid from the capillaries into the interstitial space. So the solutes fail to enter alveoli. Why? Because there is osmotic pressure in the interstitial spaces. Okay, so this osmotic pressure will uh, pull back and draw the water that can be found in the alveolar air, okay, or the alveoli. But if still we have some water that does not follow the venous flow, okay, the venous end, because here this is the arterial end and the venous end, then um, um, the lymphatic system will carry this remaining amount of fluid back to the venous system and to the heart. Okay, so by this slide, we'll finish our presentation and we'll proceed to the last part of our system.